name is Kawale. I live in Malawi. Malawi is one of the most beautiful places that you can ever visit. The land, it's just fabulous. The people are just fabulous. People are fantastic. Yes, we are. I'm working at Koma Hospital. Koma Hospital is a mission hospital belonging to the Presbyterian Church in the central region of Malawi. And we have created a network of Presbyterian Church health departments. And we were partnering with NGOs as well as government, and we call this network Uchembere Network. And our aim is to improve access to sexual and reproductive health services for women. Well, we want to improve access to health services for women in general, and we feel that the best entry point is to improve access to sexual and reproductive health services. As a hospital, our catchment population is about 50,000. Wow, okay. And yes, most of them are women, right? So maybe 60% are women. And we have recently gone beyond the hospital. We want to bring health services closer to the community, and over 60% of people in Malawi live more than 5 kilometers from the nearest health facility. Okay. But many people live less than 2 kilometers from a church. So a church becomes an obvious, a good entry point into communities. So we want to take health services to the people through churches. Our church currently has a membership of about 2 million people. Wow. Of all ages, and in Malawi, about 52% of the population is female. If a health system is oriented to serve and to treat women, then we have a strong health system. And maternal health and child health is an indicator of the quality of a health system. So if we have a health system that treats and serves women and reduces the number of maternal mortality and child mortality, then you're able to see that you can comfortably say that this is a well-running health system, and it's a responsive health system. It's the ability and for a family to choose when and how many children they should have. That's a broad definition of family planning. We want every woman to have a choice when to have a child and how many children to have. We have outreach clinics, and at our particular hospital, we go out to the communities twice a week, every Tuesday and every Friday. We have different sites that we visit. We have a schedule, and these community nurses, they go there and they provide this health education. But also in the hospital, we have a family planning section where people can come to get, to discuss with community nurses about their intention to plan their family, and also just to seek advice on how they can do it, and if they can find supplies, they provide it with them.
So the Presbyterian Church in Malawi supports family planning?
The Presbyterian Church supports family planning.
Okay. And yes. People understand what it means?
Yes, they do. Yeah, they understand what it means, and it's not a very controversial within the church. It's not a very controversial issue.
So when you talked about the community health workers that on Tuesdays and Fridays go into the community, how many nurses is that, and how are the programs funded?
The hospital funds the program. Start with the funding. The hospital funds the program from its resources. We have some funding from donor-funded projects, and we use some of that to provide transport, to get fuel for the people who go to those clinics. The government provides the supplies, and the government also provides personnel. We have extension workers who help the community nurses, and the family planning methods, they're provided by the government when they're available. We haven't had we've run out of supplies for the past 2 or 3 months, so it's a very difficult situation now. We currently have 3 community nurses. As of 5 months ago, we only had one.
Oh, wow.
Now we are just lucky to have been able to get 2 more community nurses, but it is better, but it's still not enough. The health worker crisis is still there.